Good afternoon, everyone. Thank you for being here. Let's go through some numbers. Unfortunately, we've lost more neighbors in our fight with COVID-19. We lost one female Caucasian woman in her 90s in a hospital, and we've lost two more individuals in nursing homes over the last 24 hours. So I want to think about their families and them, and certainly we grieve for them. We grieve for everybody that we've lost to COVID-19, but also certainly our thoughts and prayers are with the families of anybody who's lost a relative or loved one over these last 70 or 80 days, as it's been very difficult to be together and to really pay tribute and respect to those that have fallen. We've now lost 82 individuals to COVID-19 in Onondaga County. Related to testing, big topic. So far we've administered 20,312 tests. 19,483 tests have been returned. That is 1,443 tests that have been returned since yesterday. This is a massive number of return tests, which represents the proactive testing that we've been doing. As we know, through proactive testing, we're doing this. Our partners in state government are continuing to test in nursing homes. So we'll go over some numbers here. We now have 1,488 positive cases. We know that cases are going to go up when you do this kind of testing. That's 63 more cases since yesterday, and 17,995 negative results. We sent 1,779 tests from Onondaga County alone since yesterday. Our figure alone exceeds the regional mandate of 775 daily administered tests to reopen. It more than doubles it. We now have 829 pending tests. 7.6% of the results we have received are positive. Proactive tests, again, we're not testing symptomatic folks. That's going to drive your positive percentage down. That's why that happens. This week we will be doing universal testing at the Syracuse Community Health Center site. And our first mobile testing location will be tomorrow, Thursday, and Friday at our WIC parking lot at the old No James Market on Gifford Street. Testing will be given from 11 a.m. to 7 p.m. both days. I would ask those who are planning to get a test there tomorrow to please go to our health department's website. You can find that at www.ongov.net. Click on the health department and pre-register. By doing that, you'll get an appointment time. You'll be able to come in and get your appointment. Won't be waiting in a line. For those who just show up, there could be a line. So again, this is part of our proactive testing strategy. We're going into neighborhoods where we feel that we haven't gotten enough data related to testing. We have the Syracuse Housing Authority has a building right there as well that we're working in that building to get these folks there. And in addition to that, we still have the Syracuse Community Health Center open for testing for anyone who wants to get a test. Okay. Regional testing. Let me turn this over. Okay. We've talked about as a region. We've talked about how the state system has numbers that are always 48, 72 hours old. And we talked about how the state has agreed with us that for moving forward, because the proactive testing rules have changed, that our results Monday and Tuesday would be used, not waiting for them to hit the state system, but we certify that these tests have happened and where they have happened. So when we look at this, we needed 775 tests administered per day. What we did in this chart here is we took from the state health department 5 days, what the 5-day average were from May 6th through May 11th. And then we did what we did over the last 2 days on Monday, 1,064. And yesterday, our region did a whopping 2,186 tests. You add this all up, the 5 days from the state system, the 2 days of tests that were done, 5918, divide that by 7, 845, larger than the 775 average necessary for restart. So we believe as soon as this data is given, 2186 to the state health department has it now, state has it, that certainly the numbers speak for themselves. Today, we have another massive testing day going on in our region. We are doing, again, the Syracuse Community Health Center. You have your hospitals testing. We have our nursing homes now that have to meet mandates, and they're testing. So when you look at all of it and you add it all up, we will have well over 1,000 tests done today, maybe even approaching 2,000 tests again. So we have met our goal. We have met our mandate. We have proactive testing and nursing home testing moving forward. We'll continue to meet the mandates. But if you just look at the numbers, Cayuga 193 yesterday, Cortland 111 yesterday, Madison 17 yesterday, Onondaga 1,779, almost tripling our mandate for the region, Oswego 86, 2186 alone yesterday. And so we're really, on the 7-day average, we are 70 tests over what the minimum is now. Looking at hospitalizations, we have 56 individuals in the hospital, 2 more than yesterday. Represents 9% of our active cases. We have 15 individuals in critical condition. This is 1 new person who's in an ICU. This is 2% of our active cases. So the percentages are actually very stable. The numbers might go up 1 or 2 or down 1 or 2 a day, but certainly they've remained stable. Let's think about our folks who are in the ICU. These are the folks who are in really tough shape. And hopefully, let's say some prayers that they get through this fight with COVID-19. A little bit more information on those who are hospitalized: 42 Caucasian, 10 African American, 3 of another race. 1 individual has not shared their demographic data with us. To date, we've had 178 people released from the hospital. That's up 2 from yesterday. So overall, 1,488 positive cases since March 16th. That's up 63 on the day. We are presently monitoring 647 active cases, 47 cases more than yesterday, 764 recoveries. That's up 13 from yesterday. 3 individuals out of our 63 are household contacts. 49 cases have come in from nursing homes over the last 24 hours. So when you do that, you have 52 minus 63. We have 11 from community spread. 5 out of our new 7-day average. We track community spread very closely. That's the indicator of the randomness of the infection in the community. Right now, in our next 7-day moving average, we're through 5 days. We're in day 6 right now. We're averaging 13 cases of community spread a day. Certainly, so far, so good related to this week, and certainly numbers that we are very comfortable with. We expect those numbers to go up with restart, just naturally, more people together, and that's why when we talk about restart, social distancing, physical distancing is critical to that. The rules don't get laxed. We're just allowed to get back the economy going again. We still need to be better than we ever have been for physical distancing. Related to our total active cases, well over 2/3 now are related to contacts and affiliations. We now have 1,596 people in our community in isolation or quarantine. CDC guidelines have changed as far as quarantine times related to isolation now. It was 7 days, no symptoms, no temperature for 7 days, you could be moved from an active case to a recovery, 14 days for a senior. The guidelines have now changed. No longer is it 7 days, it is now 10 days. So if you think about this proactive testing, you find these asymptomatic individuals, they will be in a quarantine for 10 days now, and they may never have symptoms. But again, this shows you, this week shows you how at different times you learn more about the virus, you learn more about the regulations to restart. You have to pivot your plan, and pivot, and the data means something different than our active cases for a long period of time were are really a moment in time, a snapshot in time. Now, because it takes longer for folks to recover, to get off the active cases, that's not the metric that it once was. Now we're certainly watching that percentage of positive cases and certainly watching that community spread number very, very closely as we head into restart. When we look at total number, who the cases are, who they've been, 875 female, 613 male, 47 under 19, 236 in their 20s, 182 in their 30s, 189 in their 40s, 224 in their 50s, 200 in their 60s, 164 in their 70s, 156 in their 80s, and 89 in their 90s. And we have one individual that we don't have their age yet. Percentage by breakdown, 19% are under 30 years of age, 31% are under 40, 44% are under 50, 59% are under 60, and 41% of our cases are over 60 years of age. Breakdown by municipality, 776 total cases, City of Syracuse, 345 recoveries. Town of Onondaga, 119 cases, 29 recoveries. Town of Clay, 118 cases, 83 recoveries. Town of Geddes, 82 cases, 23 recoveries. Manlius, 64 cases, 49 recoveries. DeWitt, 62 cases, 45 recoveries. Salina, 61 cases, 40 recoveries. Cicero, 54 cases, 33 recoveries. Camillus, 45 cases, 33 recoveries. Lysander, 30 cases, 26 recoveries. Pompey, 24 cases, 21 recoveries. Skaneateles, 15 cases, 14 recoveries. Van Buren, 15 cases, 4 recoveries. Marcellus, 6 cases, 4 recoveries. Atisco, 5 cases, 4 recoveries. Lafayette, 4 cases, 3 recoveries. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. And Tully, 2 cases, 2 recoveries. Certainly, we continue to talk about it with physical distancing, mask wearing. Certainly going to be a large part of restart, large part of what our normal lives will be for the immediate future. So let's accept that. Let's let's continue to do the good job that we've been doing as a community. The community spread numbers are very, very strong for a community our size. Certainly, that's a tribute to the work that everybody has done, taking this virus very seriously, and we'll need to continue to do that. Restart, I'll take questions on restart, but Upstate Triage Hotline, again, right now you can get asymptomatic testing, so this is really if you have symptoms and you want to talk to someone to help screen your symptoms. 315-464-3979. Our seniors, healthcare worker, and adult nutrition hotline, 315-218-1987. Again, this is for folks who have never really needed help before due to maybe a medical condition or from a timing standpoint, can't get to the store, need a meal, need help with groceries, certainly other types of items. Please call that line. We'll figure out a way to help you. Continuity of care, this will be important moving into phase 1. 315-446-1220. This is our Child Care Solutions partnership where we are doing daycare slots for essential employees. Been a really, really strong program throughout this process, this pandemic. This program, at minimum, is extended through May and has slots available to folks that may be getting back to work next week. And 211 for social and emotional support. The only health effect of this virus is not getting sick with a respiratory illness. It has changed everything, and that has an impact. And it has an impact on addiction, has an impact on mental health, and certainly if people need help, please, please, please call 211 for social and emotional support. Questions?
Ryan, I think you said 42 cases in one day from nursing homes?
More. 49.
All from nursing homes?
Correct. The state's doing, the state of New York's been testing in nursing homes, all residents. I think what you see is they've started that. We've been talking about this for a long time. Very happy they're doing it. Then, in addition to that, the new executive order requires 2 tests, and it starts today, 2 tests a week. I think it starts today, either today or next week. But we're working with the nursing homes, and they've started testing.
Are some of those staff then?
All of the ones we're working with are staff. Related to the number we give with affiliations, yes, staff and residents. There may be some staff in that number, but I just know that they're affiliated. Anytime there's a nursing home employee and or resident, that positive goes to a nursing home affiliation.
But that larger number suggests that there are maybe some facilities where they have some outbreaks that are almost out of control. Are they able to isolate people when they find positive?
If a facility does not have its own COVID unit now in a nursing home, we have built up enough capacity in other facilities to take those residents so that they can get treated in another COVID unit in another building. But certainly there's no doubt the virus is in these buildings. There's absolutely no doubt.
Do you know how many tests the 49 positives were out of?
I don't. And we won't know those. We've finally got a batch from the state health department, but those aren't even in our numbers, right? Our last 2 days, right? They might have showed up in some of these numbers, and we just didn't know it. But the last 2 days, those tests at those facilities on the residents aren't even reflective in our total numbers.
Based on your conversation with the state yesterday and your confidence that Central New York is meeting its testing requirement, I think some people expected the governor's numbers to reflect that in his presentation today. It didn't. Were you disappointed to see his numbers still?
Well, I looked at the date on his presentation. I think it said May 11th. So when you look at May 11th, you're looking. I don't even know if these numbers were totally reflected in his presentation. I know these ones weren't. There's no doubt. These numbers into that average, these are the numbers, Andrew. These are the state's numbers. They're right here, right? That's their numbers. We even got Mother's Day in here, right? Mother's Day is in the 7-day average where we didn't even have our testing sites open. And then you add in this capacity, boom, math is math, numbers are numbers, 845 is bigger than 775. So I think the state's going to have these numbers tomorrow, and the data will tell the story.
You expect the clearance to be tomorrow?
I don't know. I'm under the assumption that this is a data-driven process, and the data is going to drive this. And you know what else is going to happen? 414 is going to fall out of the 7-day tomorrow, and there's going to be another number like this, and this number is going to be 25, 30% higher than our mandate. So, we'll share it again. But the data, this has been a data-driven process by the state. It has been by Onondaga County. We've met the mandates.
Mirabou Spa, and I might have been saying that wrong, but the spa in Skinny Atlas, they put out a release saying that they're going to be opening on Friday. Can you kind of comment on that? And then also, are you concerned, kind of going off that some businesses will try to open under phase 1 that aren't necessarily approved to do so? Yeah,
so if you're a spa and you're selling a retail product, you probably can open. If you're probably trying to give massages, we don't know if you can open. We're looking for that guidance from the State Department of Health. That may fall under a medical type definition. That's where you see your foot doctor, your eye doctor, your dentist, many other doctors waiting for this guidance. We've been talking about that in our regional command group, saying we need this guidance. We need our other surgery centers that are sitting on the sidelines because the definition's unclear, and these are professions that have a license. They're not going to do something to jeopardize that license, so we need that guidance. So we're waiting on State Department of Health to give that guidance for all the medical-related fields. But I could say I've never been to the spa in Skaneateles, but if they sell something, a retail product, they could potentially sell that curbside under phase one.
But they're, as far as like their massage services and the pools that they have there, that we don't know.
I
if
don't
that's
believe,
open yet?
we don't have enough guidance on that right now to say whether that's allowed on Friday or not. So I would be cautious. But hopefully, but again, this is it's easy, remember, and this is just the reality of this. It's very easy to shut things down. You say you're not allowed to open anymore, and things get shut down. It's very hard to start things up when you're dealing with a pandemic, with a virus that you then have to figure out how you operate with, and you can do it in a safe way. So we have to be nimble, and we have to be able to pivot at every step of this process. So I know it's frustrating for a lot of the business owners. We're talking to them every day, and we just don't have great information for them yet. But we'll get through all of this. We'll get through all of this, and I think in phase one, hopefully for that business, we'll have some guidance from state health to know if their whole business can operate this with phase one, or if just a piece of their business can operate.
What's the biggest missing component that you wish you could tell businesses? For businesses that are itching to open Friday night, Saturday, whatever it is, assuming the state gives clearance, what's still missing from the state to your office that would be really important for them to know?
Well, we think there's going to be a certification process that they're going to have to go to, a state-driven website. And then local enforcement is going to certainly be on us. So we're waiting for some of the guidelines related to that. And if they don't come, we'll figure out our own guidelines then. But we've been very focused in on getting, and again, when was it? Last Friday I was telling you all we're going to hit our testing numbers. And I was saying we'll do 3,800 tests by Wednesday. I think I said that. Why did I know that? It's not that I'm that smart. It's that we had everything scheduled. And so I still have another day, and we already hit 3,300 tests. So we'll do more than 500. So I lied. We aren't going to do 3,800 tests. We'll do a lot more than that. But we were very focused on hitting this mandate. Remember, last week there was a question, do you need to hit 775 tests a day from May 15th moving forward, which would be easier to do because that's a new rule, or did you have to meet that goal in a 7-day process moving up, which would be harder to do because that wasn't the rule before. The rule before was you needed to be sick to get a test. So we got clarification on that because initially when it came out, there was actually two different things that said two different things. One said moving forward, capacity to meet that testing, and one said average. So once we got clarification, we started scheduling these things last week for the beginning part of this week, built up the infrastructure. It's very hard to get this much testing done with all your partners, and so that's what we did. So, overall, I know I've been on a little bit of a rant there, but related to all of this is all a process. We have to pivot. We haven't focused in on the business regulatory side yet because that can't start until you did hit this. The data speaks for itself on this now. Now we can start to focus in on communication with the business community and the consumers about what's open, how to do it, how to operate safely, what we're going to regulate, and certainly we'll take our regulatory authority very seriously.
Can you figure that out by Friday?
I think for the most part you can, and I think there's going to be more guidance on who's allowed to operate, And then it's really making sure that they're doing the things that are necessary, making sure that your proper PPE, specifically if you're in a medical field that's opening up for the first time. Don't say you got your PPE just to schedule and then we show up and you don't have it. That's a fine. So there's these things that are going to matter. And then there's going to be things that are gray, that aren't defined that well, and our law department will give us a judgment call.
Will there be a time that businesses across central New York will resume? Or is it something where they'll need to enter their information, submit some sort of a plan, wait for approval, wait for communication with their local counties, and it's more of, okay, you can go Saturday, you can go Sunday, you can go Monday?
I think once we get through phase 4, that at that point, it's what we understood as normal from the what we can do in our day-to-day lives will be there. It's just we're going to have to do it differently.
What about phase 1, though? What about this weekend?
Well, this weekend, look, there's going to be some sort of a test station online, and then you can open up, and then you're going to have to be smart and you're going to have to be safe, protecting your employees and consumers. Because I can promise you, if you're not, your employees will email us. That's what happens. And then we're going to then go and we're going to start an investigation. And if you did something wrong, one of the things we said to the state is if we're going to have to enforce this, we're going to need the ability to fine, because this is going to cost us money. And then we're going to have to enforce this to make sure that people take it seriously. So there will be fines, and so there's still a responsibility here to fight the virus in real time, and I know we're going to do a great job with it. And I know businesses have been hungry to get back. They're going to do the right thing by their employees, by their consumers, and we're going to get this economy going again.
So if I'm a business owner and I'm not certain whether I qualify in phase 1, or if I'm a little puzzled on exactly what rules I have to follow, who am I looking to for guidance?
Us.
Is there a website?
Right now, there's no website, Tim. This is, again, we are waiting for guidance from New York State, and we anticipate some of that guidance will be coming tomorrow. This is all, we use the analogy, others have used it. You're on restart. Nobody's ever had to restart from a pandemic over the last 100 years. So the analogy of you're putting the airplane together in the air is a fair one, and that's kind of what's happening. So as frustration exists, and we appreciate that, nobody's ever had to do this before.
So what are the fines, and what's the authority for issuing those?
We don't know yet. We're waiting for guidance from New York State.
Those would probably have to be affirmed by a judge at some point?
No, we would be given that by New York State via a health order, the Department of Health, similar to a food inspection, and it would be similar to that. What we can and how you fine will probably be related to public health, but again, these are the guidance that we have not been given. If we get the green light that we can make our own guidance, we'll do it. But there's a process here. It makes the most sense to have the same set of rules for every region throughout the state, not just one region doing something differently than another.
So right now it sounds like you'll be enforcing this, or you're thinking you're going to be enforcing businesses opening based off fines is the main way you plan to do that?
Yeah, well, commercial activity, right? You have different enforcement. The law is still there related to large gatherings, 10 people right now. At some point that will probably loosen up. But right now, that's what it is. Our health department's not going to go and give a fine out to a group of kids together. Your local law enforcement agencies would do that via the calls. Now, when you're talking about commercial activity, businesses, that's easier to regulate. Why would there be a new regulation? Because your actions may be against the overall health of the public. So that falls under the public health department. We'll have our own enforcement unit that we will work through, and then once we understand what powers we have given to us by the state in this exercise, then we'll be able to communicate. If you do X or Y or Z, you could get a fine. There needs to be that communication. In most cases, you'll get a warning first. So this is how these things can roll out. But again, I wish we had more information, but we just don't yet.
As far as like, obviously right now the essential businesses that have been open this whole time have already made changes. We see that they're all wearing masks. They have, plastic up between the cashier and the customer. But when some of these other businesses start to open in the phases, what do you kind of anticipate will be necessary for them to also do? I mean, do you think everyone will have to have PPE, or what changes will have to be made?
Yeah, I think everybody, if I'm a business owner, I would anticipate that there should be lots of sanitizer as your customers come into the building. There should be masks for you, your employees, and your customers. And that's the rule now, right? You don't need a mask if you're 6 feet apart, but if you're within 6 feet, you need a mask. That's the rule. So those are your basics. Certainly, if you're a manufacturer, reach out to your association, McMahon, because they've already been doing this. If you're in construction, they've already been doing this. There's someone who's been operating. They know best practices on how to do this. Even in retail, there's businesses that have been doing this, that you can reach out to your associations and your peer groups. But certainly, that's the bare minimum.
The expansion of curbside retail is something that you've celebrated. That's a big step. How different will Monday feel to everyone?
Yeah, I think so. That's an interesting question. I think Monday will be a hopeful day, kind of a relief, I think, for a lot of us who've worked very hard to get the community to this point. And then I think where you see it, especially if you're downtown, I think phase 2 is when you kind of get a sense of, another emotional hurdle, because that's when you'll see a lot of the buildings starting to light up again, and you'll see people walking the streets more. But certainly, I think getting to where we are, meeting the criteria that we've met, and this long fight with this virus is an emotional victory for the community, and it's kind of like a relief that we're here now, and there's light at the end of the tunnel. And so I know for our team, this has been a trying 7 days related to what we've had to experience, that we knew it was coming. We knew we were going to see death rates higher when we saw where cases were. We knew it was coming. That doesn't change how painful this process is. And we knew at the same time we had to do everything to meet these metrics to restart our economy and balance the needs of the community. And so now we're kind of here. So it's just been a brutal 7 days for many of us, but hopefully Monday's a day where there can be a little bit of hope and a little bit of relief.
Have you thought about altering the executive order on malls to allow for curbside retail?
I've not extended my executive order on malls. We're going to let the phased-in guidelines determine when the mall can open. So my executive order keeping the malls closed is now expired as of, what's today, the 12th? It expires tomorrow. Certainly that would allow some curbside pickup, but the mall will be impacted in different phases of this on how it can operate.
Curbside retail, though, could be a go as soon as their stores are ready.
Correct.
We're talking a lot about businesses reopening, but as far as, I think people are probably wondering when they could, in small groups and safely, start to visit family and friends again. Do you think that will be something that will come in phase 4 or maybe sooner?
Yeah, I think overall, so right now technically, we were in the heat of this virus, this very scary. We know a little bit more about it. We still need to learn more and more about it. But right now, essentially 10 people you're allowed to be within. You can go, see mom or dad, but it's, if you want to be the safest. For me, I could not afford to be sick. So I have not been seeing anybody outside of my building, in my immediate staff, in my immediate family. But others have been going and doing the right thing and sit with a neighbor. I live in a neighborhood, and I see neighbors sitting 10, 12 feet apart, but still enjoying each other's company. There's nothing wrong with that, but we just got to be really smart. So at some point, can you do more than 10? Of course. When is that? I think you got to see what phase 2 looks like, and I think that's really a phase 3 type play when you open up, and allow things with gatherings. Maybe in phase 2 you go from 10 to 25. Maybe that's something the state looks at, or a different number. And then phase 3 you go a little bit higher. Then phase 4 you got things back to where they should be. But certainly phase 2 is more about the face-to-face interaction in your financial services, your professional services getting back together again, and that might be a good time to test some of those numbers a little bit, but not too much.
Speaking of gatherings, I think you had a call with school superintendents today.
We
What
did.
was the discussion about graduation and whatever else you talked about?
Yeah, we talked about graduation, what that looks like potentially when. Again, we think certainly nothing's going to happen before June 15th, and things go well, maybe June 15th to July 15th, maybe later in July. We talked about what kind of facilities we have that we want to open up to them at a reasonable rate, so that people could be outdoors, or we talked about the ballpark. We talked about the amphitheater. We talked about Onondaga Lake Parkway. And we're going to work with any of our districts to try to do something memorable for our seniors at the appropriate time when it's safe.
It seems pretty obvious that you're going to hit the numbers for testing and for all the other metrics. So is that like you pass the test and then you go and nobody counts anymore?
No.
If we fall behind on any of the 7 metrics, what happens?
Yeah, I think that's when you have your, if you fall behind, that's when you probably can't go to the next phase. So certainly every day we can't do 2,000 tests in our region, but we will need to average over 775 on a 7-day average. And so what we are doing is our facilities are still open now to asymptomatic folks, but we're doing this proactive surge in different pockets. We're looking at other employees, frontline law enforcement. Talked to Mayor Walsh about maybe doing some things with some of his teams. But I talked to Chairman Knapp about going into the southern towns. Not a lot of cases in the southern towns, a lot of anxiety, haven't been able to test. Now they can, but maybe we take our mobile unit to the southern towns. We have people asking us to take them different areas. We want to use the mobile testing unit in a strategic way. So some of these ideas accomplish that, while at the same time keeping asymptomatic testing available. But really what you got to look at too, Tim, is these nursing homes are going to do our numbers for us by ourselves. Keeping enough tests available with the labs just to do the nursing homes is going to be a huge challenge for our emergency management team, and one that we're coordinating, because if we fall behind, we can't afford for anything to happen in these buildings.
But your understanding is if something happens, the hospitalization rate, if for any reason we suddenly aren't passing a metric, we don't go back to what we have now. We just
No.
get locked in phase.
Yeah, you're in phase 1 until you get out of phase 2. Phase 2 till you get out of phase 3. There's no going backwards unless something horrible happens that everybody feels we got to go backwards. And so, but yeah, so your command team, and it's really our data, right? Our data for our region is going to drive this whole process, and so we really drive the information to your command team with our other counties, and they're now doing a lot. My partners in Cayuga and Cortland and Oswego and Madison are have been stepping up their game testing. I mean, Cortland gave us 111 tests. I mean, you know how many tests that is for Cortland County? It's a lot of tests. So we're going to need them to continue to do that. But some of them have nursing homes as well, so that will produce numbers. But yeah, we're not going to fall behind on this number. We're going to be far ahead of it. This was part of our strategy anyways. It's just now we know the number that we have to meet, so we have to be more aggressive than what we were.
The testing twice a day is a state directive, and nursing homes fall under the state. Yet, the county has to step in to provide test kits.
Yeah, and we're going to get some of those from the state. We're going to ask the state for a lot of them. But you can't, remember, our communities vulnerable are in these buildings. The regulatory agency is the state of New York. Assisted living facilities, which fall under our purview, are also under this mandate as well. So we have to make sure that they're meeting their mandates so that they don't run into regulatory issues, and we got to figure out something bad happens, the state has to come in and take over a building because that might fall. So make sure and help them get through this. Many of these facilities aren't hospitals. They're not equipped with traditional COVID units. Nobody was equipped with a COVID-19 unit when this happened, and then we quickly learned, and thank God we have the hospitals we have in our community. So you learn, you pivot. The virus invaded our buildings, especially the ones with seniors in them. Now we're going to try to find little hidden pockets anywhere we can. You learn and you adapt, and hopefully we get through this and this thing doesn't flare back up down the road later in the year. But if it does, we'll be better prepared because we've just gone through a series of battles with it, and we've learned a lot about the enemy.
Are you helping the nursing homes because you're a nice guy, or did the state put the onus on county executives, county leadership to make sure that governor's executive order is followed?
Nice guy, Andrew. Some would disagree with that. I'll say, though, we are doing this because it's the right thing to do, and they need help, they need guidance, they need leadership. We've offered to play an active role with nursing homes from day one. From day one, you can go and rewind the tapes. We said we will do whatever's asked of us because these are my constituents and they are vulnerable. And so now we have to continue to make sure the employees are COVID-free. 2 tests a week, aggressive, but we'll figure it out. And then the other part of this is very important with the governor's order. We talked about this because before his executive order, this is a very something we agree with. The hospital's got to test and make sure that that is a negative, that you're not sending someone to a nursing home that could be COVID positive. So that's a big piece of this as well that our hospitals are working on as well, using their rapid testing for that. So important. These buildings, we have to do everything we can to protect these buildings and everybody in them.
Could you talk about the clay warehouse project and if it potentially is in jeopardy with everything going on here? Did a tenant sign a deal before the pandemic, or have they signed a deal?
Interesting question. I haven't got that one this week. Look, we feel really good about where that project is. I think there might be some activity going on that site. So more to come on that.
The governor has said, I think, that one of the things they're going to watch during these phases is the transmission rate, which is kind of a mysterious number. Have you heard lately what our transmission rate is?
I think that's kind of the antibody. Well, I've heard him say 1.1. I'm assuming if he's saying 1.1, what that means is our regional population times 1.1% is how many, and that would be that many active cases. If you have that many active cases, now that would be a lot. That would be like 8,000 cases, which would really, if you look at our numbers, I think I would agree that that would be a real problem, because I think we have, 8% of our active cases in the hospital, and then 2% of our active cases in ICUs. I would assume those numbers would hold true, and that means you would have 800 people in the hospital, right? We'd probably be in big, big trouble. So I think that's what the governor's referencing. And we would agree if that's what he's talking about is the issue. I've heard him talk about antibody testing again. Antibody testing gives you a broad stroke of maybe those who have not been directly sick. At one point, I think a week or so ago, Central was at 1.9, second best in the state, behind North Country, but we're much denser than North Country, so really, compared to our peers, the best in the state. That's good for us now. In a second wave, that means there's more people, though, that probably haven't built up immunity, so we need to continue to be very diligent with our physical distancing. Whereas one could suggest in a second wave, the communities that have been ravaged by this, our friends in Long Island and the Hudson Valley in New York, might be a little bit better shape with immunity. So I believe he's talking 1.1 of the population based on the region of active cases at one time, which would be a very, very large number.
Has the state health department seen these numbers now?
Yeah, they got the 1064
So,
yesterday. They got 2186 went to them mid-morning.
have they formally agreed that you meet the metric?
I don't know. I don't know when they're going to tell me that. I'd share the information with you as we get it, and I can tell you our today's number will probably be between the 1064 and the 2186. Maybe we'll see if I'm wrong. Maybe it'll be a little bit higher, but it'll be another strong number. Other questions? Certainly want to give a big shout out to our friends and partners in law enforcement. This week is National Police Week, and it's certainly, when you went to the academy, and I was at an academy graduation with Mayor Walsh for SPD, I believe in the fall. I think there might have been another one even in the winter. There was not COVID-19 training for these officers and these deputies, and their jobs got more and more complicated throughout this process. So I want to just recognize them for their sacrifice, their heroic actions day in and day out. And certainly they've had to do more and adapt to these changing times, just like we all have. So please, when you see a police officer, a sheriff deputy, thank them. This is from May 10th to May 16th is National Police Week. Thank you.